Welcome everybody to the first webinar in our new series called Breaking Barriers Together. Within this series, we're going to be looking at how barriers which autistic carers and autistic adults experience when accessing healthcare, how can those barriers be taken down? We will be looking at how we can work with professionals to see what barriers are there from that side, as well as working with autistic adults to see what it is from their side of barriers once they get to the healthcare setting. So throughout this project, we are talking to local autistic adults and local autistic carers to get their experiences, and we've got the opportunity to film them talking, so you will be hearing from different local people just describe the experiences and difficulties that they come across. Some of this will be in video format, but for some people they don't like coming to meetings to be filmed, so we've recorded some people over Zoom, and for other people that don't like being on camera, so they've emailed us some of their thoughts. So you will be getting their experiences in different formats throughout. As part of this project, we are going to be developing a professionals toolkit, and we are going to be looking at trying to get some appointment letters. We already have a few samples now, and asking some local autistic carers and autistic adults to have a look at these and reword them to make them easier to understand. We have got some feedback, as you will be hearing, how sometimes it's the appointment letters themselves that can cause confusion as to what is required of them and where they should be. We understand that with some appointment letters, they come from a national base, but for those that you're able to have any influence on yourselves in the local practices and local areas, just to help you to have a new look at them to see how they could be reworded to make them a little bit easier to understand. When we're talking about autistic adults, we are talking about some that do not have learning disabilities, therefore the easy read option can be quite insulting to that cohort of people. They just need things set out in an easier to read, understandable way, which won't just necessarily benefit autistic people. I'm sure that the whole population could benefit from having things that are just set out a little bit easier. And then the videos that we are making for the different workshops, we'll be holding those on the website. We're also going to be filming some professionals talking about how they deliver things differently to an autistic person, because already our project has changed shape. When we've been talking to some professionals where they've understood that some colleagues might be a bit hesitant at carrying out screenings with somebody who is autistic, not knowing how to talk to them, just being a bit unsure how to be. So we thought if we can get some videos of people who feel comfortable in those settings, just to show and give some examples of how you can communicate differently. So we're just trying to break down any barriers that are there of just people just not understanding how to talk, how to communicate, how to interact, and who are scared of making mistakes. So this toolkit will be developed and held on our website, and things will be added to it as we find more things that are of use to professionals. So these are the three webinars that we'll be doing. So today it's looking at access to health and social care appointments, although we have taken social care out of today anyway, because the this is again how things change. The adults that we were talking to, none of them were involved with social care, seemingly. So we did not get any feedback from them for this, but everything was about health. And then we're going on to looking at barriers to attendance for cancer screening appointments, and then also for health checks. All of these workshops have been recorded, and the recordings will be held on our website, which is, they'll be held on YouTube with links on our website. But afterwards, Annette, who sent the email out in the first place, will be sending out the recording to you. So you've got them and be able to share with colleagues. the chat feature, we would really love you to use it today. If you've got any questions as we go through, put them in there. If somebody else who's on the call sees a question and thinks, oh, I know how we've been, dealing with that, please do share your experiences with others, and any that we don't have time to answer, we will look at and send emails out afterwards. It is a fully packed thing because we've got so many videos to show you today, which is great. To start off with, though, I would just like you just to take a couple of minutes and just put in the chat feature just 3 words to describe how you would feel your confidence is when you think about what the barriers could be to healthcare for somebody who is autistic. What could be done better? How confident do you feel that you could change what you're doing, that you can identify the barriers? So just 3 words just to describe that, please. So if you could just put those in the chat now, that would be great. Just putting in your 3 words. I'm just going to carry on to the next screen. So I just thought it would be good to give you some statistics about why the need is there, that why we have thought this was a good thing to do, and to look at what the barriers are. So there's been some recent work done. In BLMK, the Learning Disabilities and Autism Strategy has just been published, and within the work to develop that strategy, the load of stats were found, and so this is showing how autistic people 16% less likely to receive bowel cancer screening, 10% less likely for breast cancer, 7% for cervical cancer, and then there's the other for the people with learning disability, and those will be learning disability, some with autism as well. And so when you look at these, it's like, why are the barriers there? And so we thought it would be a good idea to go out and ask those questions. But also, just to give you a bit of a scare, really, these stats are also very new out, and it's a bit scary to see how there is this sudden climb of numbers. This is an all-age diagnosis, but how they have spiked so much within the last few years. And when that is broken down, the majority, the larger numbers are within children's age groups, but then going up through adults. But all of it shows is that, that the more children that are getting diagnosed, they are becoming more adults as they get older. And then, how healthcare does need to address that as all these difficulties appear as people get, as they grow up. So starting to look at barriers to health and social care appointments. So we held a voice group and met with some people, and one of the guys there who is transgender, and we do not go into asking questions about how far down transgender groups, the transgender process somebody is. But he told us about this, that he'd gone on the eConsult to try and get an appointment with his doctor. And this was the question on there: tell us your sex, female or male, which to us was quite shocking because you don't often come across that now. Usually there's a lot more options there. I have been in touch with eConsult and they are changing it. A few people have raised it with them and that is getting changed. And the guy who told us about it, what he was saying, and bear in mind, he's autistic and he shoots straight from the hip. It's very matter of fact how he's talking to us. And he said he did not know how to answer that. And I said, we do not ask how far down the process somebody is. And it could be that he'd not gone through the whole process of transgender. And so he is displaying as a male, but the way he was talking, it could be that he still probably has ovaries. And so he did not know what to do on this as to how you respond to it. And so it's no help to anybody. So the reason for bringing this up is please check to see that this is not in any documents that are old, that haven't been looked at lately, any processes that you've got. It is worth checking just to make sure that things are upgraded right the way across the board. Because I said this one was one that you would expect not to still have just the 2 options on there. Now we're getting on to appointment letters, and this was something that came up very early on when we were talking to people how difficult appointment letters can be. And so I'm going to play this video where you can hear people talking about their experiences.
No, I don't find appointment letters easy to understand.
I think they're easier than what they used to be. So now most of our letters in the centre will have bold capital, the date and the doctor that you're going to see. But again, you know, they don't make it clear, as in they'll say what department. I think what would be more helpful is if they maybe sent a map out and put where the car parks are and where the department is that you're going to have. So you're not walking around. I mean, Harmony doesn't really go to the hospital very often. She finds it too distressing. Sensory wise, it's too overwhelming, too many people, the noises, the lights. She doesn't like it. She gets really anxious. She'll start picking at her skin and her face. And by the time we got there, she's in a state. So
I wish they had more information about what procedure is, what procedure you're actually going to be having done. I suppose what I mean by that is the actual information. Because I feel like I had one recently and where it was very much scattered information and it was very loose. So in the end I had to Google the information. And but then even then, I still couldn't find out if that's exactly what I'm going for. Like, I don't know if that sort of makes sense. So your anxiety level is still very high because you don't know if when you go to that appointment, if that's what they're talking on about. I don't know, it just feels up in the air. But if you had your appointment letter, but then a leaflet saying, like, today, this is what you're, this is what's going to happen. You're going to be seeing a nurse, a breakdown of actually what's going to happen in your appointment before you get there.
So just a few tips there as to things that maybe could be done differently. Being aware that an autistic person may have very literal thinking. So it's looking to see if the wording on the letter actually means what it says and not what you think it means. And we've had it from a few people where it's very vague and that they read them and it's like they're just not sure what they're being told. And especially with follow-up letters as well, as to what are we supposed to do now? Is the doctor going to ring us? Do I need to ring them? When do I ring them? And is it my GP or is it the doctor at the hospital? It's just making sure that the information is really clear. And an autistic person processes information differently. So it's good to have information broken up rather than a whole text and a huge paragraph. Maybe breaking it up into sentences with a gap so that somebody can process one bit at a time and go back over it and process it. An autistic person will probably read that letter a few more times than a neurotypical person will read it. The important information about the date, time, who they're going to see at the start of the letter, so they know who it is. And is the information clear on who they're going to see, what the appointment is about, what the department is? And I think I might go and say it in another slide, but I'll still say it now. This is what it says about the department. Is it the same name as when you go to the hospital or whatever? Does it marry up with what is on a board? I know I've been to appointments before where it's been quite different, but I've got the ability to go and ask somebody. And you get a lot of autistic people who, when their anxiety is risen, they may be able to speak really eloquently in this sort of situation. They might talk to you fantastically, but when that stress is there, the anxiety is up, a few people go mute and nothing comes out whatsoever. So they're not able to ask for directions or ask for clarification once they're there. So looking at appointments, we're going to go on to show another video, but this is some feedback we've had by email. The reason my adult son will not attend any healthcare is mainly due to trauma caused by appointments he'd had as a child, where there were no adjustments made and he was forced to undergo treatment without any understandings of what was going to happen. And as a result of that, he does not feel safe or trust health professionals. So obviously, you know, the barrier is there. But the barrier is there from somebody who's been very young. So I'm just going to play another video now. And
I would say getting the appointment is quite hard, so sort of ringing up. And I have to get my partner to ring up, and then he has to explain on the phone that he's my carer. And then it's sort of getting the appointment, and then I find... So that's like the first barrier is sort of getting the appointment, and then getting the appointment time that is best suited, so not in the busiest time. And I find that sort of one of the barriers, and sort of trying to avoid getting a telephone appointment, because at the moment it's very much we can get a doctor to call you today, when actually I find it hard to talk on the phone. So it's trying to avoid the fact that actually we would prefer to see a doctor face to face, but of course then that delays the appointment, because of course they say, well, can you ring back the following day at 8 o'clock in the morning? So it's sort of like you're on this delayed sort of thing. So even before you get through the door, there's sort of like delayed sort of thing.
Yeah, it's really hard because to get appointments, the only way you can get an appointment at a lot of GPs now, including mine, is to call them up. And I find that very difficult. I don't like calling people up because I get very anxious about it. And I've had quite a few bad experiences ringing my GP where the receptionist has answered and been quite rude, because when I get anxious, I tend to stutter a bit, or I don't always know what I'm saying. Like I've got the words in my head, but they won't come out in the right order. And then the receptionists in the past have got quite angry with me for that, and then that just makes me more anxious. I also don't like having to tell the receptionist what the problem is, because firstly, I think really that's something that should be between me and my GP or the nurse. And secondly, on several occasions when they've referred me through, they've sent me to a nurse, and the nurse has immediately said, "Oh, I'm not sure why they sent you to me. You should have seen a doctor." And yeah, so that's what stops me going to the GP, really.
For us personally, it was better in COVID because we had Zoom appointments, which was a lot easier for her because she didn't have to leave the house, especially when we were seeing the hematology or the diabetic dietitian. So to see the diabetic dietitian, they don't have one in the community, so we have to go to the hospital to see her. So again, that's very stressful. We did try the park and ride to our local hospital, but again, that was very stressful. The buses, noising, lots of crowding on the bus, so that didn't work. And often as well, if they're running behind, you then have to go out and put more money in for the parking meter, and you've gone for the results and they can't find the results, or they don't know what the results were. I think things like that, they could just tell you over the phone, rather than put my daughter through all the stress of taking her there for then go, oh yeah, the test results was normal. All they need to do is communicate more. I think if they just took the time, especially with the vulnerable adults, if they just took the time to maybe send them to ring them rather than sending everything through letter, because then you can have a two-way conversation and say, well, that time won't suit us, or can we come in early? Like my daughter with her social anxiety disorder, being around crowds and lots of people was very distressing for her. So we would prefer like first thing or last thing rather in the middle of the day. So I think if it was just the receptionist, medical receptionist just rang and said, oh, hi, we've got this appointment. Is that time better for you? Or is there anything we can change so Harmony's more comfortable? I think that would help.
I'd just like to say that, like, not autistic people are the same. And I think sometimes that's sort of, people constantly think that, like, you may say one need is your need. And then they automatically think that the next autistic person who comes in, they have the same needs, so they may not ask, they just sort of make assumptions. And so if one person says they want to be in a quiet space, and they make the assumption that the next autistic person might want to be in a quiet space, but actually that autistic person might not want to be in a quiet space. So it's actually sort of asking that person what their needs are, and that rather than sort of just making the assumption.
So we also had this through on an email as well. I recently had an appointment letter from ELFT, which just gave the first name of the doctor and the appointment time. It did not say whether the doctor was for a psychiatrist or a psychologist. It did not say what the purpose of the appointment was. When I rang the receptionist, they couldn't tell me straight away who the doctor was. I was on the phone for 10 minutes and was getting very stressed. During this time, she listed all my diagnoses. I did not know why she did this, and I don't think it was at all appropriate for her to do so. The appointment was a review with a new psychiatrist. The last one was 6 months ago. I'm supposed to have them every 3 months, and this was also the 4th psychiatrist in 2 years. So you can see why some barriers are just there, because people are just not trusting in the system and what people are saying to them. And the person that sent this we know quite well, and she's had so many difficulties throughout the mental health system over the past sort of 10 to 15 years. And it's a credit to herself that she is where she is today, rather than the support that she's had because of people. She's a female, she's autistic. A lot of people are still not understanding what the differences are in a female and recognizing the masking that somebody is doing and covering up their needs until that mask comes off because someone is so stressed that they can't mask anymore, and then they're just not coping with anything. And an autistic adult who's a carer, she was saying that she herself has been trying for many years to get GPs and other healthcare professionals to consider opening up once a month to allow autistic children to visit surgery, the dentist, the optician, wherever, so that they can meet the clinician without needing treatment. So it's taken away the fear of the unknown, so they can have everything explained to them as to what happens once you go to an appointment. And so that it can build up the trust and reduce the fear of when they do need to go. And she's sure that if clinicians did that, then she's sure more children who are autistic would be able to access healthcare more easily. So it's just trying to give them a good experience when they go to see the doctor. And then, of course, we get cancellations. And so this is the effect that cancellations can have on people.
And I think also as well, they don't take in consideration when they cancel appointments as well. Like when my daughter, it's a couple of weeks of preparation, where we're going, the time we're going, the time we have to leave. She has bowel problems, so she gets upset tummies when we leave the house. So we have to know where all the toilets are so that we're prepared. And I can sometimes take a week or 2 weeks preparing her. And then you just get the day before, oh no, we've cancelled your appointment. And then that stresses her out even more,
Since entering the mental health service in this borough, because obviously I've moved boroughs a few times, there's only been one psychiatrist I had consistently. Aside from that, every week it was a locum or a new psychiatrist who'd leave a month later. The appointments, they get arranged and then they cancel them right at the last minute. So you're arranging to get over to the other side of town or something like that. And then like 10 minutes before your appointment, you get a text saying it's been cancelled or something. I know they can't always help it, but like I find it quite frustrating. I get very upset and anxious because I've got it in my head that this is what's happening today. Thinking about going to the appointment is enough to send my anxiety through the roof. And then I kind of feel after they tell me it's over, so you put me through all that anxiety for nothing. And now I've got to wait. There's another day I've now got to go through that.
Yeah.
And you think the mental health service or all of them would understand things like that, but they don't seem to.
So she was saying something similar to the written slide earlier. They are two different people. Obviously had some very similar experiences. I've just seen a message from Julie. There is a digital coding system coming in. I think it's coming in next year for GPs, which will enable reasonable adjustments to be coded on a patient's file, and hoping that this is going to make a big difference. So this people will know beforehand, if somebody looks at the records, what the reasonable adjustments are needed for that person, and hopefully within that can be put in about people needing early appointments, late appointments. But it's also this need for like being able to see somebody the same. We're aware that, you know, appointments do get cancelled, but it's something that just to bear in mind, of checking whether this is the patient that you need to cancel the appointment for, if there is a choice of patients, so that you've just got to sort of cut some patients out for that day. For somebody who's autistic, they will learn by experience of getting a really bad past experience and having it there, which will then be a barrier in itself for somebody doing it again and trying it again. So an example is, if it was cancelled last time, why should they believe that it's going to happen the next time? And there's a lot of work goes into preparing somebody for something that is out of the ordinary. If somebody is going for an operation, it's not something they're having every day, so it takes a long time to prepare that person for it. And then for it to get cancelled has a huge impact on that person. And the anxiety that comes with it can prevent somebody going again to something. And I know from personal experience, I have a son who's in residential care, and his social worker cancelled an appointment with him. He had been prepared that the social worker and myself were going along to see him for a meeting. The social worker didn't turn up, and that was going to be about 12 o'clock. His support workers had the rest of the day trying to get him to understand that the social worker still wasn't coming, and it stopped his day moving on. And they had a really bad time with it because his anxiety was through the roof. He was okay the next time, except the next time she cancelled again. And so it's then, well, how much do we prepare him for the next one? Because the person might not turn up the next time. So it does have a knock-on effect when these appointments are cancelled. And we are all well aware that sometimes that can't be prevented. But it's just knowing that there is going to be an impact on that person if it happens. So then we're moving on to waiting rooms, and whether this is in a doctor's surgery or in the hospital. And so we'll hear what they have to say about this.
Yeah, and then once we get to the GP practice, it's sort of the whole waiting room. So we have to sort of check in and that. And I think it's sort of explaining that actually not all the time you could sort of be in the waiting room. So you sort of have to say to the receptionist, you know, you want to be somewhere else. And it's that whole explaining that you're not being difficult, you just want to be somewhere else where it's not busy.
My daughter gets really frustrated when she has to wait a long time. Again, because she's in an environment that's noisy, lights, sensory-wise, it's never a quiet room. I know some people don't always want a quiet room, but for us, it's easy if we have a quiet room. And they don't often, you know, for patients, it's normally a busy environment, the waiting area.
I think one thing that sort of bothers me about waiting rooms is quite often there's music playing in the background and things like that. And I know that they're trying to sort of, you know, they think it's quite calming to have sort of the radio playing or music playing. But when you've got music playing and people talking, and then you've got the telephone going off, and then people...
It's just sensory overload, isn't it? Sensory overload.
And, you know, it just makes the environment really, you just want to go out somewhere else, because it's not just being in that environment, it's the fact that you're waiting. So you're waiting for your appointment, and so yeah, it's sort of that building up, and I think it is sort of, saying to that person, well, there's a quieter space somewhere else, and or even all it has to be is just round the corner, in a corridor, and at the same time, letting that person know will let the doctor know that you're there. And so you don't have that other added anxiety of feeling, well, does the doctor know I'm sitting here?
Another waiting room that I think is very distressing is A&E. They have a separate department for children, quiet area, if you've got a poorly child, But my daughter, because she's 21, has to go in with all the drunks and all the people that have had a fight on a Saturday night or whatever. And again, the waiting rooms are very small. The chairs are very close together. My daughter doesn't want anyone even to touch her or look at her. The fact that the chairs are all kind of generic, they're all kind of glued and stuck together. We'll just, even if you can get her through the door, she'll just go, no, and walk out again. Because it's too busy, it's too noisy. Again, like you were saying, having a separate area, I think would be a lot helpful. I'm not saying that they have to almost like treat them differently, but just offer them a different option, like if you want to sit there, or there's a quieter space around the corner, like what you were saying. Because I think by the time that they get to see the doctor, they're so wound up or anxious that you just don't get the best out of the appointment.
So I was trying to read Amy's comment on here. I could only see half of it. If I moved it, the video would have stopped. I think you said that you work in the NHS, and it's confusing for you as to why. Why do you have to tell somebody? Why can people not see it in notes that somebody is autistic and needs something different? And we've had it from people, I'm not sure whether it's in a piece that we've got on here or not, of where it's happened time and time again. And it's, why can't you just read it? Somebody had come out to see them and didn't know anything about them because they hadn't looked at the notes beforehand, and actually didn't have a clue what they were going to see them or talk to them about. So here's some tips of within waiting rooms, and this is, wherever you are. So does the patient need to let a receptionist know that they're there? And is there an electronic way of doing this? Now, I recently went to my GP, and we haven't lived here that long, and it's a very small GP practice. And I just got the feeling from when I told the receptionist that I was there, that there was another way of signing in. And it was only on my way out, I spotted a computer over in the corner where you could register for yourself. That information needs to be given out to people before they go in. You can't just assume that people will know. And how is that process? If you sign in electronically, then who's going to come and see you? Who knows that you're there? Is it the receptionist will know? Is it the doctor will know? And just having a sheet of paper about what the process is, whether you're going into a hospital appointment or to a GP appointment, what is the process when you get in? So it's clearly stated and nothing is left to the imagination, because for an autistic person, that unpredictability is one of the worst things. They're probably already going to be anxious about going to the appointment, and to have all these other things that will add the anxiety to their appointment time means that by the time they get in to see the doctor, the professional, they're probably not going to be able to get the information across as to how they're feeling, what it's all about, take in any information that's being said. So it's really important that information is given out beforehand. Is there a quieter place for someone to wait? And as I think Pat said on there, it's not the same for everybody. Some people want a quieter place. Some people quite like being in the hubbub and see what's going on. So it's just making sure it's right for every person. In COVID, if you went to see the GP, you had to wait outside in the car park, and the doctor came out and brought you in. For some people, that would still be the best way to do it, so they didn't have to sit in the waiting room. And for somebody who is also more concerned about picking something up from somebody in the waiting room, where people are coughing and everything else, that might be the worst place, and their anxiety is so through the roof, they might actually go home before their appointment time is called, just because they don't want to be around where other people are looking and sounding as if they've got something contagious. Let people know if their appointment's going to run late. You know, quite often you can be sitting there in the waiting room and your appointment has gone 10 minutes, 20 minutes, and you're still sat there waiting. For somebody who is autistic, their anxiety is going up, just to let them know. And it's you know, you can do it as a general announcement to everybody, because everybody is probably happy to know that, you know, Dr. So-and-so's appointments this morning, we are running about 10 minutes late. He will be coming out very soon to get the next person, just so that people know what's going on and they're not in the dark, and help reduce the anxiety of somebody. And just again, checking that the information you give, it says what it means and it is clear. So for that literal person, the information is in the right way. So now it's all about finding your way around and finding that appointment room, wherever it may be. So here we go again.
Sometimes they don't make it clear where the actual room is, so they don't take a photo of, like, this is where your actual appointment is. Like, some hospitals, they're brilliant and they have, like, the lines on the floor. Like, they'll have, like, so let's say outpatients might be blue, so you just follow the line. But, like, some hospitals, they just sort of, like, they have, like, the things on the wall. So, like, they'll have, like, outpatients, and then they have, like, maternity, and then they have thing. And then you think you're going the right way, and then suddenly the sign disappears. So you, like, go down a corridor and you're thinking, oh my God, where am I? And then you're going around in circles like 15, 20 minutes, and you can't find anybody to help.
When you actually get there, it can be very hard to find the place, and there doesn't seem to be anyone about sometimes, like, to guide you to the right place. And I think one of the things I find really hard is not being told what's going to happen as well. Like, what does the place I'm going to have to wait in look like? How long might it take? Is there often a delay in the place? When I actually get in for my appointment, what's going to happen? Things like that. That's not explained. So then I'm sitting there half an hour late for my appointment, getting more and more anxious.
Even if they couldn't, like, do the line, it's color coded. Everything's just kind of, you know, it's very much, you know where you're going, and that just takes one anxiety level, like, off. And yeah, it's just simple things like that, I feel, you know. And it's not just going to be like me, is it? It's going to be loads of people that helps out.
Harmony doesn't really go to the hospital very often. She finds it too distressing. Sensory wise, it's too overwhelming, too many people, the noises, the lights. She doesn't like it. She gets really anxious. She'll start picking at her skin in her face. And by the time we got there, she's in a state. So, but the times that we do have to go, especially if we go for blood tests or things like that, they need to simplify it, you know, just make it more simple, and maybe each department on the map has a different colour code or something, so you know I'm going to zone red or zone blue, so it's just easier.
Well, it's hard to get anywhere in the hospitals generally, but there quite often isn't anyone around to ask, and quite often there's been a few times where I've gone to where I thought I was supposed to go, and instead of sort of politely being asked to go elsewhere because I'm in the wrong place, they almost get angry with me, and it's like, right, I thought I'd come to the right place because I can't understand this letter. It's confusing me. And then no, they don't tell me if it's going to be late. So if my appointment's at 2:30, I'll expect someone to come out at either 2:30 or in the next 5 to 10 minutes max. And if I don't hear anything after that, it gets quite stressful. So like just a very quick, someone just like the receptionist just calling over, excuse me, just to let you know your appointment's running a bit late. I'm sorry about that. Should be about X amount of minutes. Or like they might not know, but just to let you know, rather than having you sit there, wondering what's going on.
Yeah.
Because then, of course, you also get the anxiety, have they forgotten I'm here? Which probably not, but you do worry, don't you? It's like,
So some tips, and we are trying to find out locally with a couple of hospitals about maps of the hospitals to see if they can be upgraded. But they are especially hard places for people to navigate around. So is it possible that when you're sending an appointment letter out, is it possible to send a map of how they can get to where they're going? I recently had to go to a meeting in a department within Bedford Hospital, and the person that had set the meeting up sent me a lovely email with the information on how to get there. And I walked through the hospital with my phone in hand, reading her signs, because without them, I would never ever have found where I was going to. The signage was not there, and it was just terrible. So it is, if you can send as much information so that they can actually find you, or even if there's a receptionist in the hospital that they can go to who can give them a map and show them on the map where they need to go to. And does the wording on the appointment letter match what the signage in the hospital says? I think it was Pat again in that was saying that he went so far along corridor and then it just disappeared off the notice board, the word that he had been following. So it's just looking to see that you can actually get there. And with all these things, sometimes it's good having somebody with fresh eyes, somebody who doesn't work there, just checking through everything to see whether it is as it says. Because sometimes when you work in a place, you get blind to what there is there because you know your way around so well. So that's it with that. And then we're just going to move on to some frustrations. And we've got Donna talking about some frustrations that she had.
I'm my daughter's representative. I'm her appointee. I've got it on paperwork, but the GPs they still don't understand. So I go into appointments with my daughter. She's quite happy to go into the appointment. She doesn't like touch. So even me, I haven't been able to touch her or hug her in over 10 years. She doesn't like anyone to touch her. And GPs don't get that. They don't understand it. So even on a basic communication level, I talk for her. So we'll have a conversation at home. And then when we leave the home, that's when her mutism is affected, her eyesight, like she doesn't give eye contact, she struggles with things like that. So I'll talk on her behalf. But they insist that because she's 21, she has to sign a form to say that I can go in appointments with her. Now, she doesn't know what she's signing to. So they can give me a form and say, oh, can your daughter read and write? Can she sign it? Yeah, she can sign it, but she doesn't know what she's signing to. So from my point of view, that avoids the whole form. If you've got someone that's got additional needs or, Harmony's got a high functioning autism. So she's quite clever, but she struggles really on a social and emotional and communicational level. But even from her point of view, she doesn't understand, like, why do I need to sign a form for you to come in? Like, you're my mum. I don't get it. So I think from a neurotypical, if you were talking about an average 21-year-old who'd be like, why are you coming in with me, mum? Then yes, because they want their privacy. They want to be able to talk to doctors about things that maybe they don't want their parents to know about. But from my daughter's point of view, who I know everything about her, I look after her, she's non-verbal, she needs me to go into that appointment. So just putting a form in the way just creates that barrier. She did sign it. The doctor's got the form that they wanted, but she didn't know what she was signing to. So it's a bit difficult, I think. And GPs have also changed now. They're not your family GP anymore. Every time you ring up your GPs, it's a different doctor. They don't know who you are. They don't know who your daughter's needs are. They often ring up and say, can I talk to Harmony Godfrey? When actually, no, I'm her mum. Oh, well, why can't I talk to Harmony? Well, if you read your notes before you rang me, she's non-verbal. Oh, okay. So I think it's lack of knowledge, lack of understanding, and you just don't get that personal care anymore. It's frustrating. It's frustrating because I'm just trying to get care for my daughter. And when you have to explain yourself all the time, but actually it's on their records. They have it in front of them. If they just scrolled through and as soon as I give her name and date of birth and her address, they should know, oh, you know, this is Donna, it's her mum. You know, we don't need to keep asking, but they do. They will insist. Even when I go to appointments with Harmony, I'll say exactly the same thing when I walk in the room. I'm a representative. Harmony's non-verbal, I'll talk. But they will still ignore me and still talk to Harmony. And Harmony not understanding, she will not give eye contact. She might say yes, she might say no, but she'll just randomly say yes and no to things that she doesn't understand. And then it creates a barrier because then they don't get the answers they need. And I get frustrated because they're not listening to me. And then it's a waste of an appointment because you haven't got out what you need to get out of it, basically.
I think one of the things I haven't mentioned yet is the times they give the appointments, because I'm in a care facility, that I'm in supported living, but my carers only work from 8 o'clock till about 7 o'clock. And quite often I'll get given appointments that are out of those times or very close to those times. So like it's no good giving me a 8:10 appointment or over on the other side of town or in the next town. But at the moment there doesn't seem to be any way of them knowing this. Like I've told them again and again, like various people, like the GP, people making appointments. And there was even one case where he rang up and said, I can't do that time because my carers don't start work until 8. So they gave me a new appointment at 8:05. It's like, well, you do realise I still have to travel from, I think I was in a village at the time, quite far from Bedford town centre. So giving me 5 minutes to get from my care home in a village about half an hour away to the hospital in 5 minutes, like it just wasn't going to happen. And like I say, there didn't seem to be any way of them having this on record, which was very frustrating. And I know I'm not the only person, because pretty much all care homes, residential or supported living, work the same way. So you get sort of staff 8 till sort of 5 or 7. Usually they have a break between 3 and 4. So you know there are certain times of the day which just are not suitable for most people in care.
I'm just going to pick up on what Donna was saying about the signing of the form and talking to her, talking to the daughter rather than her. This is where, you know, it's different for different people. We would always suggest that you talk to the patient themselves because that's the person who you are going to see. But it's also for some people, they will not want their parent in that meeting. It just happens that Donna's daughter does. But for others, it could be that they will not want their parent in, even if they can't verbally say it. They might have the mental capacity to not want them in. And for some, it might be that they would like another advocate rather than their parent there. So it's not just a straightforward thing. What Donna is explaining is their preference, but that's not the same for every person. And I think that's one of the difficulties around autism, is that everybody is so different, their needs are so different, and so it's not one thing fits everybody. And this other person came by email and said to us that my adult son said to his learning disability nurse, why do we not have special nerd hospitals when we have when we have special nerd schools? He said if there was a specific hospital for adults and children with autism, he'd find it easier to attend because main hospitals are very busy. There's often police, there's drunk people, or people seriously hurt. And this all causes him anxiety because he doesn't know what might happen. Obviously, we have not got the funding in this country to have specific hospitals, But it's just by putting reasonable adjustments in place that they can make something so much better for somebody who's autistic. And sometimes it's not that the reasonable adjustment doesn't have to be that much, just to make the experience so much better. So it is just knowing where somebody is coming from as to what they need, and hopefully when the digital flagging system comes into place, this will help with this, that it'll be on their record to start off with. So we're coming to the end now. So when we started, I asked you to put 3 words in the chat box. I'd like you to think about it now, and I'll give you a few more minutes. Now that you've heard all these different people talking about their experiences, how do you feel now? Does it make you feel any more confident or more knowledgeable about where some of these barriers are? Has it told you things that you hadn't thought of before, or maybe confirm things that you did know and actually just reminded you of things that you need to do differently? So if you could think of 3 words to describe how you're feeling now, it's just to give us some feeling as to whether this has helped you or not. Thank you for putting all this in. So while you're just finishing with that, I was just going to say that the next webinar that we'll be doing is on the 30th of November, and we're going to be looking at the barriers to going for screenings for cancer. The 3 main parts that we're concentrating on with this project are looking at bowel, cervical and breast screenings, but you know, open to anything else as well. And then we've got a plea to you. You know, if you've come on this and you're still learning more, but you actually think, well, actually we do a pretty good job where we are. If you'd like to share any of that, then please let us know, because we'd love for you to talk at the next one and give some of your insight to some of your colleagues. So please do let us know. And if there's anything else you want to talk to us about, then Annette, who is doing all the technical stuff on here today for me, that's her email address. Then she'll pass anything on to me that is more relevant to me. Somebody asked for my email address in there, so if you just get to Annette, then she will pass it on to me. But thank you. And if there's any questions in here that we haven't asked, Annette, you're there. Is there any that we've got time to answer? Would it be possible to have a lunch and learn relating to
that one out?
to barriers into social care? Very definitely, it's just trying to get people to who so we put out pleas to everybody that we know if they would like to join in on voice groups or meet with us face to face. We did do some in the past. We did a Mind the Gap series last year, very much relating to adult social care, and especially looking at autistic carers, which is the precursor to this project. Those videos are still available. So Annette, could you possibly send out the links, because it might be that the information that you're after we've already covered in those. So Annette will send you out the links to that. Was there anything else, Annette, that you saw?
No, not that I could see.
Okay. Well, thank you all for being with us. I hope that you found that useful. Again, email us anything. If there's something else that you think could have been covered, then please do let us know. We're always trying to make change if we can, and trying to inform. So please do join us next time. Let your colleagues know, and when you get the link sent through for this, then please do share it with as many of your colleagues as you can. That would be really great. Thank you. So hopefully see you. I'm going to put it back up on the 30th of November. But bye for now, and enjoy the rest of your day.